Hello and a very good evening. This is the time for Dr.Smell-Bell-Verbal to have a sharing of understanding of temporal bones as a part of Smell-Bell-Verbal cephalocervical surgical videos for undergraduate and postgraduate level understanding in ENT and head and neck. Today we are going to have about the temporal bone. Temporal bones are special bones that are present on the sides and base of the skull. These are the sides and the base of the skull. And if you want to take the temporal bones just like this, they would be looking like this. This is the left temporal bone of my head, and this is the right temporal bone of my head. Both are forming the middle part of the skull, of which the one which is above will be the middle cranial fossa. This part will be the middle cranial fossa. The one which is behind this part will be the posterior cranial fossa. The one which is in front will be the anterior cranial fossa. So if you are taking the two temporal bones as it is, they will be seeming like this within the skull. So this is the superior view wherein you are able to see. This is the anterior view. This will be the inferior view of the temporal bones, and this will be the lateral view of the right temporal bone, lateral view of the left temporal bone. To understand this, we will take each bone separately, preferably the left one, and then try to estimate and understand each and every part. This is about the gross anatomy lecture. This is not about the anatomy which is completely needed for the ENT, but also for the anatomy students. This one which I am holding in my left hand is the left temporal bone in anatomical position. If you can take the anatomical position, this being the zygomatic arch and this being the mastoid process, it will be placed anatomically like this. For an easy understanding, Dr. Smell-Bell-Verbal has designed a way of understanding of temporal bone. If you take this as the left temporal bone and this as the right temporal bone, so I will preferably tell about the left temporal bone. So this is my left temporal bone. This part which you are seeing from laterally is the squamous part. This part which you are seeing medially is the petrous part. This part which you are seeing as an elevation here as an elevation is the mastoid part, and this part which is hanging from here, from this part, will be the styloid process, and this part which is nearer to the tympanic ring is the tympanic bone, which I'll try to explain with a diagram. So if you separate your temporal bone like this, and this part, these two fingers, they are denoting the squamous part which is there at this point, squamous part for S, and this part is the petrous part for P, and this part which you are able to see here, that is the M, is the mastoid part, and this part which you are able to see medially is the S, styloid process, and this part is the one which is there laterally, which is like a half moon shaped as I am showing. It is a T, it is tympanic part. So the parts of temporal bone are easily to remember: S, P, M, which is mastoid part, and this is T, and this is S. So easy to remember: S, which is squamous part, P, which is the petrous part, M, which is the mastoid part, T, which is the tympanic bone, and S, which is the styloid process. The same thing I would like to show in the real temporal bone specimen. So this being the squamous part S, and this being the petrous part P, that is petrous pyramid P, which you are able to see here, P, and this being the mastoid part M, and this being the tympanic bone, this being the tympanic bone T, and this being the styloid process S, Once again I repeat: S, P, and M, and this is the T, and this is the S. Styloid process: squamous, petrous, mastoid, tympanic bone, and styloid process. Developmentally, it is divided into 4 parts. That is S, which is squamous part. Squamous part is membranous or investing or dermal bone. Membranous or investing or dermal bone, which is protecting the middle cranial fossa structure. That is the temporal lobe of the brain. Temporal lobe lies here. This is S, squamous part. Petromastoid, this petrous part and this particular mastoid part, petrous part and this mastoid part are going to be, petrous part and mastoid part are going to be developing from a cartilage. That is, they are replacing or enchondral bones. Replacing or enchondral bones. Petromastoid is divided into 2 parts. That is petrous part, which is medial, and mastoid, which is lateral. This thumb, which is the lateral one. This petrous part is designed in such a way, it is like a pyramid, and it is going to protect the inner ear, which is a sensitive structure. This is the inner ear, semicircular canal. This particular thing you are able to see is the superior semicircular canal, which protects the very sensitive inner ear. So it forms a protective covering shell over the membranous labyrinth of the inner ear. So I made it a bit colorful for the understanding. So this reddish one which is there, this is the squamous part, and this greenish one which is shining below is the mastoid part. In the middle there is some bluish part which is the tympanic bone, which I have colored, and if you take it medially, it becomes like the one which is written as a lines is the petrous and petrous part as a blue color. So the one which is uncolored and then projecting stylish like a stylish star is the styloid process. As you know, styloglossus is anterior, stylohyoid is inferior, and stylopharyngeus is posterior. So this bluish one which you are seeing right now in the middle, that is, this is the green one, this is the blue one. This is developing from a membrane. Once again, the tympanic bone is also membrane like the squamous temporal bone, squamous part of the temporal bone. And this one is styloid process, as we know, is the derivative of second branchial arch. Second branchial arch having 3 muscles, as you know, styloid process along with stapes, as you know, other parts of the second branchial arch. So some people consider this is not a part of the temporal bone at all.